Hello, good evening, welcome. Tonight's event is part of the 2021 Festival of Debate, an annual programme coordinated by the social enterprise Opus Independence. This year's programme is Pay What You Feel to ensure all of our events are free at the point of access, but we do rely on donations from audience members to help us make it happen. You can support us by visiting festivalofdebate.com and clicking donate. The festival team will be monitoring the chat. We'd like to ask all audience members to please be respectful of others and remove anyone from our events who does not follow our Safer Festivals policy, which is available on our website. If you'd like to ask any questions tonight, and please do ask questions tonight, you can do so by using the Q&A function in the Zoom webinar or by sending questions to us on Twitter or on the Facebook comment section if you're watching us there. Audience members in the Zoom webinar can also upvote questions by clicking the small thumbs up icon. We will get to questions that have the highest amounts of upvotes in the Zoom webinar first. Now, tonight's event will involve us looking at the UK's response to the COVID-19 pandemic. The COVID-19 crisis has had a devastating effect on communities across the UK, with the Office for National Statistics showing a staggering death toll of over 150,000. Before we begin tonight's event, I'd just like to take a moment to express condolences for anyone watching this event who may have lost family or friends in the past year, and also take a moment to thank all of the NHS staff who have done an amazing job in incredibly difficult circumstances. And of course, also all the amazing voluntary and community service organisations who have been supporting communities on the ground throughout the pandemic. Now, holding power to account is a necessary part of being a citizen in a democracy. And tonight's event will feature three leading experts in their fields who all sit on Independent Sage. It's important to say that Independent Sage is an independent body. They are a group of scientists who are working together to provide independent scientific advice to the UK government and public on how to minimise deaths and support Britain's recovery from the COVID-19 crisis. I'd like to now introduce our first guest for tonight's live stream, who is Stephen Reicher, who is a professor of psychology at the University of St Andrews. Now, Stephen, if you could turn on your video. Hi, Stephen, welcome.
Hi.
Thank you for joining us tonight. I'm going to start with the big question, which is looking at the UK government's response to the COVID-19 crisis. What are your sort of thoughts and reflections?
I'm trying to think of the appropriate term. Hopefully despair is too strong, but certainly a profound sense of we didn't need to be here. I mean, as you say, over 150,000 people have died. That's four times as many people, 4 times as many civilians as died during the Second World War from bombings. It's one of the worst rates in the world. We've had 4.5 million cases, and I hope that we won't have another wave, but we can't be confident that this is at an end. And so the response has been dire. And when you are the worst in the world, you have to ask questions why. One could say and summarize, if you like, the UK response by saying it's been too little, too late. But I don't think that really captures it, because I think one of the problems we've had is we've never really had any sort of strategy for dealing with the pandemic. We've been reactive. We've run after infections rather than doing anything to get on top of them, doing anything to bring them down. And so as a result, what's happened is that infections have risen. The government has delayed taking any action, waited until it was far too late and they had to slam on the brakes, putting in extreme restrictions in place. And then during those restrictions, they didn't build up our defenses. They didn't build up the measures to stop infection, a decent test and trace system, support for people to self-isolate, ensuring spaces are safe and well ventilated, and so on. They just lifted the restrictions with the consequence that infections went up again. So we yo-yoed for a year in and out of infection. Now we have the vaccines. And of course, the vaccines are wonderful and nobody wants to take away from the achievement of those vaccines. But again, the government, rather than having a strategy, has just had, in a sense, it's been a one-trick pony. And the problem about the vaccines is without infection suppression, first of all, many people can get ill, can be hospitalized, and can die. But as we're seeing at the moment, if you allow infections to run rampant, there is more chance for the virus to replicate, to mutate, to bring about new variants which undermine the vaccines. So we haven't had a strategy. Even now, we don't have a strategy. We just have vaccinate, vaccinate, vaccinate. Completely agree with that, but it needs to be part of a broader strategy. We've never had that. And I think we've seen the consequences in the statistics that we've talked about. And as you say, it's important to make sure that people are very clear. These aren't statistics. They're human beings. They're families who've lost people. But I'm a behavioral scientist, and so I want to focus on the behavioral science, because one of the things that's become clear is how central our behavior is to the pandemic response. That in many ways, behavioral science has come onto the agenda in a way that it's never been on the agenda before. Even now, as we talk about vaccines, we realize that vaccines don't solve anything. It's people getting vaccinated that solve things. So you've got to ask the question of what leads people to get vaccinated or not to get vaccinated. Those questions of behavioral science have been at the very core of the response. And I think what we've seen, in a sense, is two psychologies contrasting with each other and contesting with each other. And the government subscribes to a very paternalist view of human behavior as essentially frail, that as human beings, we're not particularly good at dealing with complex situations. We're not particularly good at dealing with probability or uncertainty. And in particular, when we're stressed, when we're in a crisis, we panic. And so the public is conceptualized as a problem, something that has to be managed, something that has to be, if you like, hectored and corralled into behaving in the right way. The government has always seen the public as a problem. And what the evidence has shown in many ways is precisely the opposite. We have seen remarkable resilience. We have seen levels of adherence to very difficult restrictions that nobody expected. And almost daily over the last year, I've had media coming up and saying, will people stick with the restrictions? And even after you said yes and yes and yes and yes, they'd say, but this time, will they still stick to restrictions? And as I say, the answer has been generally yes. We've seen remarkable adherence because actually we've seen people come together as a community, a sense of shared fate, a sense of shared identity. And in that sense of shared identity, that sense of community, people have not only supported each other, but had a sense that others will support them. And that sense that others are there for you leads to a sense of being able to cope, leads to resilience. Resilience isn't something that's in us, it's something that happens between us. But that sense of shared identity is frail. And the problem is that the government, in not understanding it, in many ways have undermined it in ways that are critical. Now, they've undermined it in some obvious ways. They've created a sense of them and us, of different rules for them and us, which probably started with the Cummings jaunt to have his eyesight tested in Barnard Castle. Very clearly, the issue wasn't what he did, it was that the government supported him and said, we're not going to have a go at him. There's one rule for us and another rule for others. But then their paternalism has led them not to understand our behavior and to begin to berate people when people don't adhere, to blame people, to treat people as other, to break that sense of bond between government and public, but also to undermine that sense of togetherness within the community. We've been encouraged to blame people, to blame students last year for the increase in infections, when that increase in infections is mainly due to the fact that students live in crowded housing. Now to blame people in Bolton for not getting vaccinated. And that blame narrative is immensely divisive, and it misses a further point. And that is that when you look at our behavior, when you look at whether people adhere or not, it's not simply a matter of motivation. Motivation is important, but it's not the whole story, because it's impossible to adhere if practically you don't have the support to do so. So if you look at the first lockdown, for instance, between 3 and 6 times as many ethnic minorities and poor people broke lockdown. Not because of motivation. Their motivation was identical. It was simply more difficult if you're deprived to stay at home and put food on the table. Or again, the one exception to the high levels of adherence is self-isolation. Self-isolation figures are low. Exactly how low they are, we're not quite sure. It's probably about 50, 40%. Why? Because it's difficult to do so. And it's difficult to do so because we have, first of all, the worst sick pay in Europe. Secondly, the £500, a paltry amount that is given to people, is only 1 in 8 people are eligible, and of those, only about 37% actually get it. So we don't get that support at all. So when you don't give support to people, they're not able to do the right thing. But the government turns around and says, no, it's not our problem. It's not that we lack giving support, it's their problem. It's their problem of a failure of motivation. So the psychologization avoids the structural factors and the responsibility of government. And on the whole, if the government support people to do the right thing, they will do the right thing. And I think one of the great tragedies, as a psychologist, one of the great tragedies of this whole pandemic is that back very early on, we started talking about terms like lockdown, which are punitive, implying that those who are infected have done something wrong, rather than asking, how can we support people to do the right thing? How can we support individuals? How can we support businesses? How can we support communities? And in that way, you ask the question, not how do we blame, as if people are a problem, but how do we work with people, a partnership between government and communities in order to address the pandemic. And in the psychology that it is presupposed, that paternalist notion that the public, the hoi polloi, aren't up to it, what the government has done is thrown away possibly its best resource, which is precisely the mutual help and solidarity amongst communities, which has carried us through things. So for me, one of the big lessons as a psychologist is, number one, we need to discard this individualist, fragile rationality assumption about human behavior. We need to understand much more about the power of the group and the collective and of solidarity, and that we must think of government much more in terms of partnership and scaffolding that self-organization, rather than either substituting for it or destroying it, as the government have done. So I'll just finish by saying this. Deenan will be able to say far more from a health perspective about how things have gone wrong. I think as a psychologist, as I say, the government have got it precisely wrong and have acted in seeing the public as a problem rather than an asset. They have acted to undermine the best asset they have in dealing with the pandemic.
I mean, just to pick up on that briefly, Stephen, I think what I'm understanding from that is almost the failure of policy became, and that of narrative became from a failure of imagination, of really understanding what makes up society.
Well, what makes up society, but what makes up human psychology? I was told by one person who works for the government's behavioural science group that that ministers love the notion that human beings are sort of bags of biases. And she tells me the story of one day walking down the corridor in number 10 Downing Street, and Michael Gove came up to her and said, "What's the most interesting bias you've come across recently?" As if we are laughing about the frailty of human psychology. And that lack of respect for, if you like, for human psychology, that lack of respect for the public, again, is one of those things which drives government and population apart, undermines trust, and undermines a unified response. So they misunderstand society, certainly, but they certainly misunderstand human psychology.
Great. Thank you so much, Stephen. So we'll come back to you again shortly when we have a wider panel discussion. So thanks very much for your time and contribution there. I'd now like to introduce our next guest. Could you please welcome Deenan Pillay, Professor of Virology at the University College London. Hi Deenan, how are you?
Hi Joe, hi, and hello to all those listening in. Thank you very much for the invitation. It's a pleasure to be in this festival.
Great, thank you, Dinan, and thank you so much for joining us this evening. So just starting there where Stephen left off. So Dinan, could you give us an overview from a health perspective, perhaps about how on the UK's response to the COVID-19 pandemic?
Well, it's a complicated question. And obviously difficult to summarize, because of course there's so many strands, and Steve has identified, the critical issue of agency of people, and we are talking about people. So if I just sort of maybe focus on two things on the health perspective, but also from the perspective of our group Independent Sage and why we came to be formed. So that was really around the concept that the government pushed very early on, which we're all familiar with, the phrase of "we're following the science," and that sounds all well and good, but there were so many flaws within that concept of following the science that led us to form our group ourselves. And of course, there are many different sciences. There is not one science. Science is full of uncertainty. The data and the evidence change, and of course, there's always contested areas. So that's the first broad area, I think, with regard to that, and underpinning this is the concept that that science is almost divorced from policy. The government, by talking about we're following the science, almost inferred that everything, all the decisions they made are based on science. But in fact, there's a contradiction there, because of course many of the scientists and scientific advisors to government, and we are included within that, within this group, but also within Independent Sage, many do advise the government as well as being sitting on Independent Sage. There has been a narrative that science is there just to provide the evidence, but is not responsible for implementing policy. And of course it is, politicians are elected to do precisely that. But there's a fault line there, because, and I speak both from a sort of biomedical science and health perspective, but also in terms of how to get evidence into practice, is that the way in which that evidence is implemented is itself a science, what is broadly called implementation science. And therefore, what I've learned over this course of the pandemic is that policy is just as subject to scientific critique as is the sort of core science that is undertaken, and that indeed has a huge impact on health, how that is implemented. So there's no doubt there's been some examples of just fantastic science that has been undertaken during COVID, and the obvious example is vaccines. A great illustration of with planning. This didn't come out of nowhere. The vaccine developments were a function of long-standing investment. I should say mainly government, and the vaccines have been based on science in different parts of the world, but almost all of that science, whether in Europe or the UK, now that we're out of Europe, or the US, have been based on state government funding which then has allowed pharmaceutical industry to then sort of invest in, but nevertheless, that basic knowledge was there. But that's been prepared for. There's been a lot of examples of over the last 5 to 10 years pandemic planning, and I think this is one of the areas of success. So I think that in its purest sense is the science, but in a way allied to what Steve has talked about human behavior and agency, is that the health implications, the health benefit of those advances requires a strong public health structure. And that's the second sort of area that I'd like to just focus on, is that I think one thing we have learned is that without that infrastructure which enables the scientific advances, whether it is drugs or whether therapies or whether it is vaccines or whether it is diagnostics, in order to implement those, there is a need for some very strong infrastructure. And it's clear that that has been found wanting in the UK. It has been, the public health structures have been whittled down over many decades, actually. And if we just look back to what the public health infrastructure was to protect us from infection, the original structure was something called the Public Health Laboratory Service, which was established at the same time as the NHS in 1948. In fact, my first medical consultant job was working for the Public Health Laboratory Service. That then was changed in 2003 to the Health Protection Agency, with huge reorganization and changed of and from a basically NHS aligned public health structure into a more government sort of arm's length body. That in 2013, that indeed was then changed to Public Health England, as in accordance with the devolved nations. But if we just focus on England, Public Health England, which was a structure that was under direct control of the Department of Health, but nevertheless was notionally independent, but covering more than infectious diseases, chronic diseases, and so forth. But at each stage was whittled down, and many aspects of these outsourced. Certainly, the local authority component of public health was diminished. And so all the infrastructure for us to then implement the benefits that we did have, a functioning testing system, a functioning contact tracing system, all of that, although the key core bits of those were there, of course, they were not there to respond. And then rather than when of course this did become an important issue of how to actually test people, how to for COVID-19, how to support isolation and contact tracing and all of that stuff, rather than the government then reinvesting in that the legacy of what had been in existence for maybe 50, 60 years, 70 years, they established completely separate structures. So, for instance, NHS Test and Trace, which is a parody, really, is not the NHS at all. It was outsourced to, as we know, Deloitte was asked to develop this, and outsourcing structures in terms of laboratories, outsourcing contact tracing to Serco and so on, was a reflection that, in fact, this infrastructure had been whittled down, and then, of course, allowing the government to take on their usual, what's become a usual knee-jerk reaction, which is, let's just outsource, that'll be better. And we know that. And I've just jotted down here the changes to structures that have happened in public health in the public health infrastructure over the period of the pandemic. Is amazing. Is that obviously NHS Test and Trace was started as a completely new structure, as we know, led by Dido Harding. There was then the announcement last year that Public Health England would be brought to an end and would be changed to something called the National Institute for Health Protection. And there was a lot of discussion, and everyone was waiting to see what happened there. Of course, that's not happened actually, but what has happened is now a new structure, yet another structure called the UK Health Security Agency, which Public Health England is moving into. Then there's something called the Joint Biosecurity Centre. So all of these structures amazingly started, and again, when you have a new structure, then you have the deck chairs change, you need new leadership and so on, all that happening during the period of a pandemic. And I do think that has severely limited our ability, two things. First of all, our ability to deliver what is needed, which is a robust testing system and a robust contact tracing, and of course, support for those isolating, as Steve has talked about. And so a lack of that. But it's also meant that trust in government has been compromised. You know, what could have been a hugely trustworthy infrastructure based on the NHS, and we can only, you know, and an example is of course vaccines, where of course vaccines have been rolled out through the NHS, and that's one of the reasons why it's been so successful. Tried and tested systems, primary care, hospitals, but also the trust that of course the population have. But that's not been matched by other areas, and for that reason, I think that is one of the reasons why there has been a poor outcome of our pandemic. And linked to that, of course, which is more political, but linked to that, and of course this will be, you know, could come up, of course, in the various public inquiries that are being and parliamentary inquiries, is the delay in decision making around, you know, when lockdown should have been implemented. Again, I think that was a reflection of the fact that we had sort of relatively weak health infrastructure. Scientists were divorced from policy, or were in some way reluctant to impinge on policy, and we had a very poor public health infrastructure, which otherwise we could have delegated these decisions to.
Obviously, you talked there about pre-existing structural problems in terms of government and the NHS, and then you talked specifically about what's happened during the pandemic in terms of reorganisations and different decision-making structures and delays in those processes. If we were going to look at what the causes or triggers for those problems were, what do you think would, you know, why are these structures built in these ways, and why were these sort of top-down reorganisations sort of been driven through the NHS at a period of, you know, was facing such extreme challenges?
Yeah, no, it's a good set of questions, and you know, we've also got to recognise that the pandemic is a real unique event, and so you know, all governments have been stressed by this, but and if I stray into the sort of the politics of, and you know, I'm just as much of an expert, or not a non-expert, as all the rest of us when it comes to making assertions about how the politics of this has been done. But my take on this is that, you know, if we remember back to the beginning of 2020, we'd just come out of a very fraught 3-year Brexit, you know, post-referendum Brexit set of negotiations, where clearly the relationships between senior civil servants and politicians and cabinet was very fraught, which, and of course, underpinning this, you really need a strong state to be able to make decisions. But clearly, that had been really compromised to all of that. Of course, there was a new Conservative government. Boris Johnson, with the sort of personality he has of boosterism, finding it very difficult to make hard decisions, wanting to be popular. I'd say probably one of the most inexperienced cabinets that we've had since in the post-war period, as a reflection of many of the senior Conservative politicians having either resigned or been sacked over the previous period. So that was the environment we found ourselves in when the pandemic came, and I think it was very difficult for Boris Johnson and the cabinet to actually, take on actually the seriousness, put in, having lost good civil servant support, and of course, with, as I mentioned, public health infrastructure being poor. So to some extent, I think that was also underpinning, that poor decision making early on.
Great. Thanks so much, Deenan, for your time and contributions there. We'll invite you back on shortly when we get to the wider panel discussion. Welcome, Anne. Thank you very much for joining us. Anne Phoenix is the Professor of Psychosocial Studies at the Thomas Coram Research Unit, University College London. How are you doing, Anne?
Very well, thank you.
Great. Thank you.
Pleased to be here.
Thank you for joining us tonight. Now, your work for the Independence Age has, speciality in looking at how the pandemic has affected different communities in different ways. And I just wondered if, again, I could ask you for sort of your reflections and thoughts on the UK's response to the COVID-19 pandemic.
Yes. Well, one of the things that was very striking at the beginning of the pandemic, when there was concern to get people all working together to do the right things to make sure it didn't spread, was that people began saying, well, this virus does not discriminate. And then it became clear from Office for National Statistics and other things that there were differences in terms of who was getting ill and who was dying. And it became quite clear that different ethnic groups had different rates of dying. And if you talked about African Caribbean, Pakistani, Bangladeshi, Indian, that 2 to 3 times more likely to die than the white British population. And really building on what Stephen said earlier about behaviour, one of the things that people then said was it must be what they're doing. So therefore, it individualised blame to groups who were said not to be doing the things that ought to keep them safe. But what people did not take into account was that structurally, people of different ethnicities are positioned very differently in society. So it's not that the virus discriminates, of course it doesn't, but that society already discriminates. And it meant that if you think about things like housing, if you think about the occupations that people are in, service occupations, in hospitals, and so on, their travel to work, that it's not surprising that they could not stay safe and that there was an imbalance. So in terms of housing, for example, if people are living in multiple generation households and so on, not surprising that there were more chances for them to become ill. And it was again very striking that that various government ministers and others, the media and so on, really began blaming the different ethnic groups themselves for problems that are socio-structurally produced. Because it's not just ethnicity, but the way that ethnicity intersects with socioeconomic resources and what's available to everyone. So one of the things that Stephen pointed out really clearly is that behaviourally, we need the government, we need the media to help keep everybody on side rather than individualising. And something else that we saw at the beginning of the pandemic and that has continued to some extent is hate crime against the Chinese, or people thought to be Chinese, they weren't always. And that's because the rhetoric was very much that this is something that's come from China. So therefore, it's the fault of the Chinese. And there were, and continue to be, an increase of hate crimes against the Chinese. And I think that that signals to us how careful we need to be about, for example, saying things like this is an Indian variant that's, might cause the vaccines to break down. Because it's far too simplistic, we don't say, this is an English variant that we mostly have, so therefore we should be against the English. I mean, the ridiculousness of something like that is immediately apparent. And I think that alongside this are various things that the government has not done. If the issue around the different rates of death and illness is to do with the ways in which people are positioned within society, what we need, and Stephen again and Deenan to some extent made this point, we need support for people so that they can do the things that will keep them safe. So that in terms of spacing, in terms of ventilation, in terms of making sure that people are supported so that they can take time off work in order to isolate, in order to look after other people who are isolating, then we need to make sure that they are not going to impoverish so that they can't feed themselves and their families. And that has been a great problem. And I think it also relates to thinking very much about vaccine uptake, because it's not just that there's been blame around behavior that's led to people becoming ill and dying at differential rates by ethnicity and socioeconomic status, but it's also that there's been such a strong rhetoric about various ethnic groups not taking up the vaccine. And I would say a few things about that. One is that, of course, most people who are offered the vaccine take it up. So it's not that most people from various ethnic groups don't take the vaccine, most people do. But actually, there are sometimes very good reasons for people not being able to take a vaccine when it's offered. One of those is that not everybody can take the time off at the times that they're offered a vaccine from their work without losing pay. And if you're poorly paid, then that really matters. Then I was struck by seeing that somebody had put a petition on the websites asking please for payment for being ill after taking up a vaccine because she'd had to take 3 days off work without pay. So that really underlines the issue that if people have any impact of the vaccine, and these are obviously minor compared with the illness itself, with COVID-19 itself, but actually they also need support then. And more than anything, people need not to be stigmatized, but to have their fears taken seriously. There's a long history of various groups not being taken seriously in health services, or worse still, being tested, having things tested on them. And therefore, some people are anxious that this is the case with the vaccine. It doesn't help to simply override their concerns, and nor does it help to override concerns about what's in the vaccine, what will it do? And it really would help much more, as some health centres are doing, to take those fears seriously, to address them, not to attempt to force people into taking a vaccine then and there, but actually letting them think about what they've heard and come back, and to recognise that this whole process is dynamic, so that having a vaccine, taking it, is not a once you've had the 2 vaccines, of course you've done that until the boosters come into play, but actually that people who don't want the vaccine today might well take it tomorrow, as long as they're given the opportunities, but also that some places are doing exactly the right things and moving the vaccines to the people. So some people are able to have the vaccine in very local community centres, in mosques, and so on, and that really helps to take seriously people's fears and the possibilities they have for actually moving to where the vaccine is, and also taking seriously their fears about illness afterwards, and so on. So there are many things that actually the government could have done that would have made life easier rather than blaming people. And I think it's also the case that the media must take some responsibility for this. And alongside that, I think many well-meaning campaigns talking to people saying, you must take up the vaccine, treats people as if they are necessarily stupid. And I think it's not that so much, that people, they listen to the media, they hear those voices, but there are also lots of other things that they're thinking about and other things that they have to take into consideration in their lives.
And just one question on this before we bring the rest of the panel back in. In terms of the health inequalities and wider inequalities that the COVID-19 pandemic has exposed, do you have, I suppose, the hope that this will result in the government almost being forced to confront these structural inequalities that previously would have remained under the surface?
Well, that is a very real hope. I think that it won't be realised unless many people, including in the media, including campaigning groups and so on, keep bringing it to the government's attention. Because I think that it's all too easy for the government to continue individualising or to slip back into doing nothing, because after all, it has not done all the things that it could have done to ensure that people are protected. But once so many people have come to be aware of just how committed, for example, various health workers are from different ethnic groups who have continued to go to work despite their fears and then come back to their families despite their fears of bringing COVID back to their families without having the resources to be sufficiently distant or to have enough air conditioning and so on. Once we see how people are prepared to be committed to the community, I think that the very least that we can do is to keep reminding government that they need to change, that they need actually to put things in order, that we need to think about poverty and the ways in which it intersects with ethnicity. So that we really need to ensure that there are public health campaigns that will help to bring everybody up to a level where it's not so easy for a pandemic to take effect amongst those who are the least protected in society. I think once we've seen that, it's really important, just as once we've seen with the resurgence of Black Lives Matter, that many people really care about social justice issues and equalities, that we need to actually make sure that governments don't get away with, for example, reports that suggest that actually there is no, for example, systemic racism, or that there are no real systemic inequalities, and that therefore people need to really accept things as they are.
Great, thank you so much, Anne. I'd like to invite Deenan and Stephen back, if you could turn your videos and microphones on and join us again. Thank you very much. We'll get to the audience submit questions in just a moment. But before we do so, I thought it's probably important to acknowledge the moment we're at now, where again there is a specific divergence, I think, between the information and the advice that Independent Sage are giving out and official advice from the government, specifically in regards to the new variant and the potential and upcoming unlocking measures. And I thought maybe I'll start with you, Deenan, to just potentially comment here on your perspective on the new variant and the potential unlocking dates that are coming up very soon.
Yeah, no, sure. We as a group, and I think many people were supporting the British government in their outlining of a roadmap to open up the economy and open up social contact, based on the fact that there was a this was going to be gradual. There would be something like 5 weeks between each of the stages. 5 weeks, which enabled us to assess what any adverse impacts there were of that opening up, and the phrase will be guided by data, not dates. But of course, you know, at the same time, the government, and certainly Boris Johnson, talked about this as an irreversible opening up. So a little bit of a contradiction there. And of course, and the government did come up with a series of tests, a little bit opaque, but nevertheless, at least some objective measures that would be guiding their assessment of each stage of that opening up. And one of those tests was, of course, you know, the being mindful of variants that would emerge that may be compromising control of the pandemic. Now variants are, I speak now as a virologist, variants are emerging all the time, and it's important to not get into this mode of thinking that a variant, you know, misnamed Indian and South African and Brazil, that's just where they happen to be identified first, doesn't mean that's where they're from. But of course, variants are emerging all the time. The question is, are there any that are taking hold before, of course, the next variants come up? And indeed, we are at the moment worried about the majority virus that is circulating in the UK, albeit that there's low levels of overall infection. Within those low levels, there's been a big shift recently into, you know, this so-called Indian variant. And of course, there's some evidence that Public Health England produced this weekend that certainly one dose of vaccine is in practice not really having nearly as much impact on control as we'd thought. So all of that, and of course we know that and it's still less than 50% of people in the UK that have had their full dose of vaccines. And of course, early on there was a decision to have 12 weeks and, you know, maximum time between those two doses. There's lots of people who've just had their first doses. So all of those things do create some concern for us, not only us, but also many scientists advising government and elsewhere that we've got to be careful. We've got to really go very slowly in opening up. And I don't say that, you know, cheerfully. I mean, I, like many others, you know, are absolutely fed up, you know, with what has been a pretty intense lockdown since January. And as are wanting to get back to some level of normality as much as anybody else. But I do think the question here is, you know, what are the risks that we open up too soon and then require further lockdowns? And I think so. We as a group in Independence Age, we're obviously discussing it at the moment and are due to sort of issue a statement either tonight or tomorrow, that we think there needs to be much more care at the moment with opening up. The idea on the 21st of June that everything goes back to normal, we think is going to be at this stage premature. Clearly, we want to support widespread vaccine uptake. Anne has identified the challenges with that and the inequity that goes with all of that. But nevertheless, you know, we need to be guided by her thoughts on how best to do that. So that probably summarizes where we are at the moment, but we're not alone. If one looks at what many scientists are saying, there is at the moment some concern that we need to go slowly.
Thank you, Deenan. Going to you, Stephen, I guess the same comment. I mean, perhaps being a bit stronger than it, there are some reports that have been suggested that the government have been sitting on certain figures that they released late on Saturday night. You know, suggestions that they were waiting for Eurovision in terms of sort of for burying certain bad news. How dangerous do you think this current moment is?
Well, you're right to draw our attention to Eurovision, because we've done as well at Eurovision as we have done in dealing with the pandemic. So clearly there was good timing in that sense. But I think you're right. I think there is a real danger we've turned a corner. For a long time, the government was basically ignoring the scientific evidence. It was ignoring the behavioural evidence. I know that firsthand because I sit on the behavioural science advisory group to SAGE, it was ignoring SAGE itself when SAGE in September called for a circuit breaker. It waited for 2 months until it did anything about that. So for a long time, it ignored the data. That's bad enough. I think we're beginning to see suppression of the data, which is deeply, deeply disturbing. So you're quite right. The Public Health England had a press conference where they trailed good news about the variant, and then they released the actual data at 10:30 in the evening on Saturday without any press at all. And actually, when you look at that data, it's quite interesting because Public Health England themselves raised the alert level on vaccines from amber to red as a consequence of that evidence, while at the same time the government is spinning it as telling us it's good news. Or to take another example, in some ways even more disturbing, some of the data still has not been published. And that's the data about infections in schools. And that links to the fact that on the 17th of May, the government took away the requirement for masks in schools. Now, I know the issue of masks in schools is highly controversial, but at least we should have good data about the risks and the dangers in order to make proper policy that will protect our children. And if the government suppresses information that allows us to make the decision, we are beginning to be in a wholly new ball game where we don't look at the science and then decide what the policy implications are. Rather, the government makes the policy decisions, we're going to reopen, and only allows us to see the evidence which fits with that. And that's not science. That's the antithesis of science. So I have to say, I am deeply, deeply disturbed. In terms of the more general issue, what do we do now? Well, in many ways, we're in a classic situation of decision-making under uncertainty, right? We don't know yet quite how dangerous the new variant is. Okay? So we do face a genuine dilemma, right? And that dilemma is, if we do reopen, we might then, by allowing people to mix indoors, spread the infection to a level that by the time we realize that the variant is dangerous, it's too late to do much about it, apart from shut things down again because it's been reseeded everywhere. That's one risk. The other risk is that if we don't reopen, if we pause, not go back into lockdown, we're not talking about going backwards, just pause for a week or two, then having built up expectations so high, which the government has done over the last few months, people will be rightly extremely upset. They've planned to see their loved ones. They've planned to go to events. They've planned to go on holiday and so on. And suddenly telling people you can't do that will be really counterproductive. Now, the first point about that is that we shouldn't be in this position. We're in this position because the government have gone from their mantra of data not dates to saying dates not data. And once you say dates, people start investing in those dates, both metaphorically, emotionally, and literally. We invest in holidays and so on. So they've created a hard place of their own choosing. But still, despite that, I think, it's my opinion, it's something based on values, on a sense of importance. I think it probably makes more sense to pause for a couple of weeks in reopening so we don't go back into the awful days of January and February and March where there was general lockdown. And that when we have good data about the new variant, and if, as we all hope, it shows it's not that dangerous, then we can proceed. I think that makes more sense than rushing ahead with the danger of having to go back to January or February. So it's a tough choice. It's not a choice without risks, but I think we can only address it if we have clear data and good data. And what's happening now with the data in terms of not releasing the data which goes against the government's policy decisions is deeply, deeply disturbing and makes a complete mockery of following the science.
Thank you, Stephen. Anne, have you got anything you'd like to add?
I think that's pretty thorough. I would just add that, as I understand it, in Bolton, the highest rates of new variant are affecting 10 to 14-year-olds. And so that says a great deal about what we should be thinking about in schools, and that actually it's not sensible to say that secondary school children can stop wearing masks without more evidence. And particularly since I don't have any evidence that school children were really complaining. I think that they had got on with wearing masks. They were used to them. So that does seem rather ridiculous. And just to reiterate that rather than it being a timetable, a roadmap would also take account of how to support people, and particularly around things like test, trace, isolate, that, where there hasn't been sufficient support to make sure that people actually are able to isolate for the required amount of time and can pay for the tests necessary.
Great, thank you very much, Anne. And we can get to a couple of questions that came in. This one was from Anne Nicholson, which says, how can we help the government to take notice of where it can improve its communications and attitudes towards the public? Maybe Stephen, should I go back to you for that one?
So let me go back. I'll come at this obliquely, but I will answer the question. I'm not a politician, so I promise I will answer the question. So first of all, I just wanted to make a point about independent sage, because some people have been critical of us, saying that we call ourselves independent sage to be independent of other scientists and provide a different set of scientific inputs. And in so doing, we've divided the scientific community and we've undermined trust in science. Well, interestingly, as I say, first of all, quite a lot of us are both on independent sage and in the government advisory groups. And on the whole, we actually don't disagree very much on the science. We agree with what SAGE said back in September about the need for a circuit breaker. If you read the SAGE minutes of May, they are saying very clearly about the dangers of the transmissibility of the new variant. And in fact, they say, on the whole, you're far less likely to regret pausing the roadmap than going ahead with it. So on the whole, the difference is not around the science, it's around the use of the science, and it's around being explicit about policy. I mean, as a member of Independent Sage, I can be much more explicit about talking about what we should be doing and about the problems of what's being done. So actually within the system, we consistently put out papers about how things should be communicated. We put them out right from the start. When there was the shift, if you remember, last year in May, almost exactly a year ago now, from stay at home to stay alert. And everybody said, look, what the hell does stay alert mean? How the hell do you stay alert to a virus that you can't see? What on earth does that mean? And the polling showed that the percentage of people who could understand it, well, 96% of people understood stay at home, because pretty obvious, stay at home. I don't know what the other 4% were thinking. 31% of people understood stay alert. They just didn't know, well, what does that mean in terms of what I do? We, again, from within SPI-B, we wrote a paper, you can see it, it's in the public domain, I'm not giving away any secrets here, explaining why that was wrong and what they should do right. And while I have limited faith in the ability or willingness of perhaps Boris Johnson and Michael Gove to take that seriously, there are a large number of quite superb civil servants who understand these issues, who work on them, who want to use them. So I do think there is value on hanging in there, providing that advice, and hoping that it might have some effect. If they don't do exactly what you say, perhaps they won't do things quite as bonkers as they might have done if you hadn't said it. But at the same time, I think there is value in being outside at the same time, talking to the public as we do in Independent Sage, having briefings where we can talk to trade unionists, to local government, to pressure groups, and to the public, who then can mobilize to try and put pressure on the government. So as I say, that twin track approach of being on the inside to try and have influence and on the outside to mobilize people to put pressure on the government, to me, is the best way forward.
Thanks, Stephen. And I suppose a slight development of that question as well. I'll put this maybe to Anne first. This one was from Anna Jones. Could the panel say more on their views of the role the media played, whether it undermined public solidarity or behavioural science, or did enough to challenge the government on its decisions? Do you have any thoughts on that question, Anne?
Yes. And I think if we go back to thinking about the issue of ethnicity, one of the things that was striking about the way in which the media covered this issue was that it had, many papers had complaints about people having funerals at mosques initially, for example, and they covered it in such a way that it blamed particularly Muslims for spreading COVID. There has been a little bit of that around some synagogues. There was a lot around mosques. And really, that was when one compared directly coverage of funerals at the time that were for celebrities and showed lots of people attending, there just was not the same venom, the same charge that this was spreading COVID throughout the population. And I think that really tells us that the taken for granteds about who people are, who's at fault, who is problematic within society, really come to the fore when there's a crisis like a pandemic. Now, of course, there have been, I mean, just think about the way in which members of Independent Sage have been picked up by the media. There's also a lot of media that really want to know, really want to get the facts straight. And as time has gone on, I think that that's been more the case, that some of the media has wanted to set the record straight, to put pressure on the government where it's needed and so on. But I do think that there are still blind spots which are around things like ethnicity and religion and its intersection, around not recognizing sufficiently the role of poverty and lack of resources and so on, so that doesn't get sufficient attention. But I wouldn't want to make the media out to be all the same, but there are some very striking examples that I think are problematic.
Thanks, Anne. Deenan, same question.
I mean, really interesting comments from Stephen and Anne. I don't want to sort of repeat, a comment, this similar sort of comments. But I do think this pandemic has identified, first of all, the gap there has been with regard to public understanding of science. Where the problems lie, but of course one of the positives is that suddenly large numbers of people understand how viruses are. I speak as a virologist, understand what viruses are. They understand how respiratory viruses are spread, what the issues are. It has actually led to a big increase in science literacy, and the media have, I think, played their part. Of course, the media are skewed because they're basically based around a political paradigm, but nevertheless, we basically, those of us who have whether fortunately or unfortunately been thrust into the media, is because basically for a year and a half pretty much, the headlines every single day have been about a virus spread, and therefore they want comment, the media want comment, and come and ask scientists for comment. So I think there's real opportunities there, I must say, to reframe what we mean by scientific literacy in a public sense, what that means for education, the interest that people have in science, and recognizing that, that this is not mystical stuff, but there is an evidence base, and people should be expecting to hear the evidence base on that. So I think there are some opportunities there. I just want to, before I finish, one thing, and I think one of the comments and questions I'm seeing in the chat was about whether scientists should become more political in this. There's an interesting question. I would rather frame it in that and I've changed my mind during the course of the pandemic. So I started off, back in the beginning, back 2 years ago, I thought, look, the role of scientists is to provide advice around their own area of expertise, and is for politicians they're elected to make decisions. But what I've seen through this is, I think anyone with insights which may be called expertise, but there may be many people who have insights. It is, we are obliged, I think, and have some social responsibility to be able to verbalize that in the context of meaning for people and society, and be able to and be willing to enter into the debate. And as Steve said, within Independent Sage, we have every week public events where people can ask us questions, and we try our best to answer. I think that demonstrates a new way and a new opportunity for how science can relate to the public, and I only hope that that's a positive thing for our overall scientific literacy. And I must say, the last thing is, I think what we have seen is the converse is the scientific illiteracy of government, and we still have the old, in the 50s, C.P. Snow's Two Cultures, which even then was talking about, basically, the art, the where the elite come from, the political elite come from educationally and so on, versus the technocrats. But in fact, I think we're still seeing that our government and civil servants are relatively illiterate scientifically, and we really need to start to change that if we're going to deal with things like climate change, the big issue that is confronting us for the future.
And just bring in one more comment, this one from Udit, which is kind of a comment on this, this stiff upper lip war spirit and paternalism that potentially, is inbuilt in a lot of, say, UK government messaging around the pandemic. Do you think that's been a useful sort of frame for narratives, or do you think that's been something that's negatively affected it, Stephen?
So let me come to that. On the media, I think we should acknowledge what an incredible year it's been in all sorts of. I was reading The Sun. I don't normally read The Sun. I was reading The Sun, and it was have a discussion of S gene dropout and the various places of the different mutations of the 3 Indian variants. The Sun, for God's sake. Who would have ever imagined that? Last year, I criticised Dominic Cummings for his trip to Barnard Castle. I wasn't alone. For some reason, the Daily Mail picked up on it and did a poll on whether the Daily Mail readers supported Boris Johnson or myself in either criticising or supporting Dominic Cummings. And I beat Boris Johnson in the Daily Mail. I will go to my grave still being amazed by that. So all sorts of incredible things have happened with the media. And I think, Deenan is quite right. There has been an incredible flourishing of science, and not just physical science, but social science as well. We've had all sorts of debates about the nature of the social contract, about the nature of trust. The stuff of the tutorial room has become the stuff of government. I sometimes joke that the BB 117 is no longer the night bus that takes you home, but the thing that keeps you awake at night worrying about what's going to happen. So incredible transformation. On the other hand, I also want to say I do think there are some tensions. This is a problematic issue. Anna's pointed to some. One of those, which I've raised a number of times, is that the media values, the notion that if it bleeds, it leads, that you go for the exciting, has led the media very often to pick up on spectacular but rare examples of violation of the rules over the reality that the most people, the vast majority of people, are adhering. So, for instance, a headline with 100 people at a house party or 1,000 people at a rave will be a headline, whereas 1 million or 10 million or 30 million people quietly staying at home won't be. And the problem about that, of course, is it then begins to say to you, well, other people are breaking the rules. It sets a norm of rule breaking. It begins to say to you, what's the point of my sitting at home if everybody else is breaking the rules? So undermines compliance. And there was a point at which I tried to argue in various places, like the Today programme, that we ought to have far more on, the dull heroism of people sitting at home. That's the real headline. And yet, of course, it's very difficult to have that as a story. So I think there are contradictory and complex issues, but in many ways it does come back to the point that you started with, and I'll come to at the end, which is this issue of trust in government and trust in each other. And I think the problem about the paternalism is a hierarchical relationship. It places government as above and outside the public and acting upon them. Whereas compliance, and there's a lot of psychological literature on this, compliance is much more to do with a notion that authority are not above us and imposing of us, but authority are of us and for us. They are acting for our collective good. And in order to gain that sense, again, there's a whole literature which talks about the things you have to do. You have to treat people with respect. You have to be willing to listen to people. You've got to be willing to admit your failures and your problems. All the things the government, with its cod blitz spirit type of notion, fails to do. So there is this triumphalism which everything has to be world class, even though we know it isn't. It treats us like fools. There's a refusal to admit mistakes and problems, as if the father figure has got to be perfect. You can't admit that mum and dad have got it wrong in any way at all. So I would say precisely that paternalism, that Second World War type of adventure comic type of notion of the world, sets the government apart from the people, fuels a division, whereas actually what we need to do is to create a situation where the government is seen to be of us and for us and listening to us, and it's not.
Anne?
I think added to what Stephen has just quite rightly said is the fact that in terms of stiff upper lip and that sort of impetus, one has to look at how members of the government behaved at the start of the pandemic. It wasn't that long before he got ill that Boris Johnson was saying, not I went to a party with thousands and shook every hand, but that, I went to a meeting, I shook every hand there. I've got a stiff upper lip, I am strong, sort of a rugged individual. And so I won't get ill and I don't need to be afraid, which I'm not sure whether that was intended to set the tone for all of us, that we should all rush out and shake hands everywhere we went. But of course, he got ill, but that was very much that notion that I think goes along with the stiff upper lip that produced, I think, more illness than it needed to. I also want to turn it around the other way, because one of the things that we're currently having to think about are the number of people who've been ill with variants. They've not gone to hospitals. They've not wanted to bother hospitals. They've also feared that they'd get ill if they went to them, and have stayed at home and got sicker, and some have died and so on. And I think that some of that, not all of it, but some of that is also about stiff upper lip and not really bringing yourself to public attention and taking up space and that sort of thing. So it's a different impetus, but part of the same coin, I think.
So we've got about 10 minutes left, so I'm going to ask this question and then might ask if people could try and keep their responses relatively short, so we might get to one other one. Obviously, there's a lot of talk about an independent inquiry into the UK government's handling of the Covid-19 crisis. Previous inquiries have taken years, if not decades. What hopes do you think, do our panel have for sort of an inquiry into the Covid-19 crisis, and that this inquiry will actually get to, the heart and the root of some of the issues in terms of how the government have handled it? Maybe start with you, Deenan, there, if you had any thoughts.
Well, briefly, my fears are exactly as you've just said, Joe, that a public inquiry will take a long time. Clearly, and I would just encourage those who are listening and elsewhere to be, active citizens in this. Lobby your MPs, mayors, and so forth, to really push for clarifying and with ideas for the terms of reference for how a chair is going to be identified, and the timing of this. And of course, there are a number of inquiries going on at the moment. There's a People's Inquiry. There's the all parliamentary group led by Layla Moran, who's also undertaking an inquiry. And there's also talk about a more science-led inquiry, and so on. But of course, a public inquiry will be an independent public inquiry will be the critical thing. So I think it's beholden on us all to be active citizens and really push for a very timely one. And the urgency is of course that we're not out of this pandemic yet. And as long as there is inequity in the world, there will still, for vaccines, for instance, there will still be virus circulating, and there'll still be future waves of infection. And the second thing is preparing, because this pandemic has happened this time, doesn't mean it's not going to happen again. In fact, it's the converse. It demonstrates how it can happen. And we rapidly need to develop our infrastructure, public health infrastructure, ways of responding that will hold us in better stead next time.
Stephen?
So if we'd had the inquiry when we first started calling for it last year, hopefully we would learn from the mistakes that we're now repeating. We might have stopped them and we might have saved lives. The problem is going to be that this is going to come too late to save lives in this pandemic. As Dinan says, it may save lives in the future pandemic, and it may do more, because I do think that one of the fundamental things that has come out of this is that those things which have been taken away from the NHS have done deplorably. Test and trace has done deplorably because it's been privatized, it's been distanced from people. Contact tracing is done by strangers you don't know and you don't trust, and they don't understand your circumstances. The rollout of vaccines, where it's been done through the NHS, has been quite magnificent, and it's even better when local GPs ring round their lists and go to people rather than waiting for them to come to you. So in many ways, I think one of the things we are learning, and one of the things we're going to have to fight for, is to rebuild a public NHS. And I hope that one of the things that a public inquiry will do and point to is that the fetishization of the private sector and the neoliberalism of this government has been disastrous in this pandemic and has cost many, many lives.
Thank you, Stephen. And I think, Anne, I'll leave probably the last word to you, I think.
Oh, well, I very much agree with what Dinan and Stephen have said. And I think that what I would hope is that an inquiry would set in place both infrastructural processes and also some curbs on government, so that there are things that they have to do and that they cannot do, so that it's different the next time, regardless of which government is in place and what they're like and so on. And also that there is more respect for people, that learning from mistakes, about not blaming, about taking people seriously, about how you genuinely give people the resources that make things easier and what you do, I think would be really helpful.
Great, Anne. Thanks very much. I think your video quality cut out a little bit there, but thank you very much, and just like to thank all of our panel for joining us for tonight's event, and everyone who is watching both on Zoom or on YouTube or on Facebook or on Twitter, or anyone's watching this at a later date. So the Festival of Debate is still running until June the 6th. So we've got a whole range of other events coming up. You can check out the full programme at www.festivalofdebate.com. That's it from me. Any last words from the panel? Do you want to say a quick bye? Cheers, Stephen.
Thanks for inviting us. It's been a pleasure.
It's been a real pleasure, yeah.
Thank you, everyone. Cheers. Good night.